We decided to do something a little bit different at this meeting and introduce something that we're calling profiles of innovation. And the reason that we're calling them that is that if we called them TED Talks, we'd be violating somebody's copyright. But the idea of the profiles of innovation is to bring in speakers who are doing innovative and interesting things. Sorry, guys. Who are taking forward-looking approaches to addressing some of the challenges in our criminal justice system, and to give them a slightly different format for that presentation than the typical panel conversation. So we've got 4 of these over the course of the day, and it's my great pleasure to initiate our Profiles in Innovation series with Dr. Howard Spivak, who is the acting director at the National Institute of Justice, which is the research and development arm of the Department of Justice. Dr. Spivak falls in this category of he must be a smart guy because he thinks what I think. And what I mean by that is it's really wonderful that the director of the NIJ is an MD and brings principles of public health and how healthcare approaches solutions to problems to criminal justice. That is a core founding principle and belief of the Quattrone Center, that these other industries like healthcare and aviation have a lot that we can learn from and apply to criminal justice. And so it's a real pleasure to have Dr. Spivak here talking about the NIJ's Sentinel Events Initiative, which he has really championed over the course of the past couple of years. Dr. Spivak started his career as the director in the Division of Violence Prevention at the National Center for Injury Prevention and Control in the CDC. He served as the Director of Adolescent Services for the City of Boston, where he co-founded the nation's first community-based public health youth violence prevention program. He was the Deputy Commissioner in the Massachusetts Department of Public Health and has served as a Professor of Pediatrics and Community Health at Tufts, in addition to other medical centers. And he's a widely published speaker, author and speaker on youth violence and violence-related issues, before coming to the NIJ and championing all their research. Without further ado, Dr. Spivak, thanks so much for being here.
Thanks. Good morning. Which is the mic here? Good morning, everybody. Good morning. You know, one of the things that I find remarkable about auditoriums like this is this low lighting that generally promotes drowsiness and sleep. So I'm going to be watching to make sure everyone's eyes remain open during this. I also want to say that John called me a couple of days ago and warned me that this symposium would be running behind and that I probably had less time than I had been scheduled to. So I'm prepared for that. And in some ways, a number of the points I want to make are really supporting and or complementing points that John made in opening this session in the first place. And that is the importance of finding common ground, and in this case, using root cause analysis or sentinel event analysis to learn from errors, which is a long-standing strategy in healthcare and in public health, but is a relatively newer concept in the criminal justice system that has historically circled the wagons when mistakes get made, as opposed to stepping back and trying to learn from those errors and, in fact, improve the system and avoid those errors. I'll also say that, you know, as a doctor, as a pediatrician coming to the Department of Justice, I felt like I'd been plopped into a foreign country. And so coming to NIJ and finding that they were in fact doing work in Sentinel Event Review and having some familiar territory there was very welcome for me. And I think, if anything, emphasized the common ground, not just within a given system like criminal justice, but across various systems like healthcare, criminal justice, public health, education, and other areas. So there's really a couple of very basic points I want to make. Oh, it's in front of me. Okay. Sentinel events are essentially errors that occur in the system. And those errors can be mistakes that are made, or they can be missed opportunities where something could have been done that could have altered the course. And I think what's important to understand about these errors, these unwanted outcomes, is that they're rarely a consequence of a single act or a single omission. They're often the consequence of a series of events where things could have been done differently. And they're rarely, even though we try to assign blame when things go wrong, they're rarely the responsibility of an individual, because often individual behaviors are a consequence of the systems they're working in, where there either lack checks and balances that assure that when a human error is made that they're picked up, or the error is made as a result of the culture that people are existing in. And I think Sentinel events, or the whole definition of Sentinel events, is that almost anything in the criminal justice system can be applied to this. And the common examples of wrongful convictions or excessive use of force by police are just a handful of the examples. And it can be everything from the shooting of an individual to the shooting of a police officer. It can include the issues of the criminal justice system and the police in particular becoming the mental health provider of last resort in this country, with a growing phenomenon of suicide by cop, where cops are often almost forced, or in some cases really forced, to shoot somebody with a mental health problem because the individual with the mental health problem has given them little to no choice. And then the consequences and fallout from that are huge in terms of the relationship of police to communities, the personal trauma to the police officer who's done the shooting, and a whole variety of things. And again, rarely do these things happen because of a single person or a single system. They're often the consequence of things that have gone wrong, or things have been missed or could have been handled differently in multiple contexts, not just within the criminal justice system, but with the other systems around the criminal justice system. Now, there are some very basic principles that need to be applied if one is going to do root cause analysis and use these errors to actually make improvements. And they're really straightforward. One is that all the players need to be at the table. If you're making the assumption, which is generally a correct assumption, that when things go wrong, something has gone wrong in multiple places, it's not just in a single place, then all the players have to be at the table. And you can't set up situations where an individual piece, a silo within the larger system, is somehow being held accountable for something that they're not entirely accountable for. So it's essential that the key players of the criminal justice system be at the table, from the police to prosecutors to defenders to court personnel and judges, to people from corrections and people even from the forensic system, science system, as well as other players such as the mental health system from a community, such as in some cases the healthcare system, in some cases the education system. The interplay between things that go wrong in education and things that go wrong in the criminal justice system are very intertwined. So it's not only bringing the players of criminal justice together, but it's really bringing a broader community of people that ultimately have some responsibility and accountability for health and safety of people in communities. They've got to be non-blaming, and this finger-pointing approach to solving problems has been historically a huge failure, because somebody gets thrown under the bus, but the problem doesn't go away because the problem wasn't that individual. The problem was a set of issues within systems that are often working together or not working together terribly well. And I'm going to actually give an example outside of criminal justice a little later on that. And the last thing that has to be forward-looking. So simply looking to what went wrong without thinking about how things could in fact be changed so that improvements are made that reduce the likelihood of things going wrong really needs to be the agenda here. Simply dissecting a problem without thinking about how to fix that problem is just an exercise often in frustration, and people may feel good about having figured out what happened, but they'll walk out of the room and within a short period of time will end up feeling just as bad about everything because these things will continue to happen. I'm not going to spend a lot of time in this because I've kind of alluded to this already. The criminal justice system responds to errors in two ways. One is circling the wagons and hoping things just go away, which clearly doesn't work. Or if there isn't somebody to blame or something to blame, then it's not perceived as there really being a problem. It's seen as a fluke, as something that can't be fixed. And neither of those approaches work terribly well. The all-inclusive nature of this I've already gone into, but this slide really represents the spectrum from criminal justice practitioners to people from government to people from other systems to people from the community themselves, including persons harmed. And persons harmed are not just victims, but they're the individuals who have often been made to feel responsible for the error in the first place. Like, as I mentioned earlier, a police officer who ends up shooting somebody because they've provoked the shooting, because it's essentially a form of suicide to do that. And all of the other social and human and health and mental health services in a community. It's bringing all of these people together with the idea of not pointing fingers at each other, but finding common ground to fix things. John alluded to this early. There's a perception in the criminal justice system that doing this kind of work can't work because it's an innately adversarial system. Well, let me tell you that coming from the healthcare system, if you put doctors and lawyers and nurses in a room together when something's going wrong, it's a bloodbath. So it's no less adversarial in some of these other systems that have actually quite effectively applied this strategy to make things better. I'd also add that in the healthcare system, applying the strategy has actually reduced lawsuits, because often the people harmed by these errors, more than anything else, want to know that something's being done to fix the problem so that other people won't suffer the way they suffered. And so there's a deep cathectic quality for people who have in fact been victimized by these errors when they see that there isn't an effort to cover it up, but in fact to open it up and to learn from it and create change. Now, I do want to talk about what NIJ is doing, because I think one of the things that's important to note is that the National Institute of Justice has actually been working on this for a number of years now. This really predates my coming to NIJ, although I did really jump behind it a great deal, in part because it was familiar territory for me, and in part because I've seen it work in other systems. It's been transformational in the healthcare system. It's been transformational in the aviation industry. Aviation errors, both near misses and actual aviation crashes have been reduced by something like 85% with the implementation of Sentinel event reviews to better understand what goes on when things go wrong and how to fix it and change it. That's remarkable. How often do we actually implement a strategy to improve things that has that dramatic an impact? And it's addressed major issues in the healthcare system, from hospital-borne infections to errors in medication. You know, in Boston, this became a big issue because one of the major teaching hospitals in the city gave a Globe reporter, a Boston Globe reporter, 100 times the appropriate dose of a chemotherapy drug, which killed her. It was a headline in the Boston Globe every day for 6 weeks. And the initial response was to circle the wagons and try to cover it up. But what it led to was real reform in addressing these kinds of issues in a meaningful way. So the National Institute of Justice has been working on this for a number of years. The Quattrone Center has been an important collaborator and partner in this, and was in fact one of the initial pilot collaborators in the work at NIJ. But I think what's also important to note is that as we talk about this strategy in multiple forums, the level of interest is growing dramatically. I presented our work in this at the International Association of Chiefs of Police to a room filled with police commissioners, and the sense of buy-in was totally unexpected. And I think that's in part because systems are beginning to realize that they can't simply try to sweep these issues under the rug, that they need to be approaching this different, that trying to do the same thing the same way without impact or without effect isn't working any longer, and that the scrutiny that's occurring is requiring that something change. We've been approached by federal prosecutors to implement Sentinel event reviews within their offices for similar reasons, because they're beginning to realize that they've got to understand what's going wrong better, and they've got to have other people at the table, that they can't simply try to fix things themselves, because the problems are not solely specific to their own context and their own venue. Our plan is to, at this point, engage with 20 to 25 communities around the country to implement Sentinel event review teams, with the expectation that in the next several years we'll actually be implementing a national demonstration project to evaluate not just the implementation of these strategies, but what in fact the outcome is. So we're not simply trying to develop something that leads to people coming to common ground, but we need to understand what that coming to common ground accomplishes. And is there real change as a result of these processes? Again, there's been real change in other systems. The hope and expectation is that will in fact occur within the criminal justice system as well. But as scientists, we can't simply make those assumptions. We've got to really prove that it happens and see that it happens. And in some ways, what's happening in the criminal justice system is happening in a more organized way than it did in the other systems, where they kind of developed on their own, were applied differently in different settings. In some areas they work, in some areas they don't work. There's not been good science applied to that. We have a real opportunity to apply good science in the criminal justice system to implementing this kind of strategy and engaging it, which really comes to the last point I want to make, which gets back to this sense that if you're in an adversarial system, things can't work. When I was Deputy Commissioner of Public Health in Massachusetts, we did a study basically analyzing the deaths of children post-neonatal period for a 1-year period in the state. And what we in fact found was that the majority of kids who died in the state after they passed the newborn period were known to multiple state agencies. but these multiple state agencies didn't know that other state agencies were involved. So in fact, there were a lot of services being applied to these families around these children, but they were uncoordinated, often unknown, and it became clear that something needed to change at a systemic level if we were going to have some impact. So based on that, I was charged in my role to set up a child death review team for the state that involved leadership of all of the state agencies that might be involved with children and families. One of the first people I spoke to was the head of the Department of Social Services. And when I described this, the foul language that came out of her mouth at me was totally unbelievable, where she was accusing me of setting up a system that was going to involve witch hunts, and the Department of Social Services would be the most vulnerable player in those witch hunts. So again, here's an example of a system where the players made the assumption that looking at these kinds of issues would only result in blame and finger pointing and people being thrown under buses, essentially. But what really resulted over a difficult course of several years of bringing people together and creating all of these various memorandums of understanding, because sharing data across state agencies is nearly impossible, in part because of some of you guys, lawyers, who create serious obstacles to sharing data. But getting through the data sharing process, getting people to sit in a room together, resulted in a dramatic change in how the state systems worked, in how information was shared, how collaboration grew, not just at the state agency level, but at all of the local neighborhood level agencies that were being funded by these state agencies. So I'm really here in part to promote this model, but in part to also assure folks that the innately adversarial nature of the criminal justice system is neither an obstacle nor should it be allowed to block the implementation of strategies like this. Thank you.